In my opinion, surgery is now at a crossroad, and it has to decide whether to go to explore new horizons like endoluminal surgery in a much more technological way. And I think robotics can play a major role now in offering surgical solutions for digestive diseases. And I'm not talking just about how to remove a polyp in a more effective way. At this conference, the MedRobotics Flex Robot System will be presented for the first time in Europe, and its application in upper GI and lower GI will be discussed transversely with colleagues coming from the gastroenterology area and surgeons. And I think this is one of the major achievements for surgeons to be interesting here at this conference. In general, surgery is perceived as something to be feared of, and this is quite frustrating for us surgeons. But I wouldn't say that it is underused for several diseases. On the contrary, I think there is an abuse of surgery for benign disease, and I'm going to show this in a presentation I will have tomorrow morning. 12% of all colectomies are done for benign neoplasms. I assume that not all the benign neoplasms today with existing technology can be easily removed with flexible endoscopy, but I think 12% to require colectomy, it's fairly too much. It's clear that there is a need of change in mentality in extending indication even more in flexible endoscopy techniques, maybe sending patients to referral centers. On the other side, surgery has to evolve to offer surgical manners to remove endoluminally these lesions in order to avoid major surgery in these patients. Being part of the scientific committee is an exciting experience. I had really no idea of what it really was before I joined the team. The scientific committee actually takes care of the program, and this is fundamental for the success of the week that we organize. We have to find tasks, we have to find topics that are interesting for all the different areas, the different souls of our federation of organizations. And this is challenging, but it's on the other side, extremely exciting to see, like we had the experience at the beginning of the Congress this year, a plenary session completely packed with 4,000 people discussing all together about indications or treatment in acute diverticulitis. Now, there are several topics that actually are transversally interesting for gastroenterologists, surgeons, radiologists, many other disciplines, different areas, that really require to discuss all together which are good indications and which treatment should be offered to our patients. And this is the real mission of UEG, and I truly believe that this is fundamental for our daily practice. Well, endoscopy evolved in the recent years from a pure diagnostic tool towards a real therapeutic tool. I don't have to make the example of biliary endoscopy. ERCP today is fundamental in the treatment of all the diseases that we see inside the lumen of the biliary and pancreatic duct. But we have to make major advances in all the remnant digestive tract. And I'm talking about endoluminal surgical solutions, but I'm also talking about delivering drugs in place. I think there's a lot of activity in research to be done in suturing devices, in novel characteristics of stents, in managing surgical complications that today require too often a second surgical look, that I'm pretty sure with more advanced systems could be avoided with endoscopic therapy. As I said previously, I think robotics will play a major role. I think miniaturizing robots will open a new scenario for endoluminal surgery at a miniaturized level. and this is the first. But I think also in screening, we have to make major steps forward. I think capsule endoscopy has to evolve and replace completely endoscopy for screening. I think only this step will convince all the people that today are not willing to attend screening protocols to finally do it and therefore reduce colorectal cancer incidence to a reasonable number. Well, I belong to two different societies mainly. The one is the European Association for Endoscopic Surgery, proud to lead the technology committee there, and I'm also the General Secretary of the daughter society, the Italian Society of Endoscopic Surgery. Now, this is a society that is prone to clinical activity. Of course, there I deal with technology development problem. I organize clinical trials, but it's purely a clinical activity like many other societies, different fields. The other kind of activity I do inside the society, I'm past president of the Society of Medical Innovation and Technology, and this is an activity I'm particularly proud because this is a transverse society embracing any area of medicine, not only surgical areas, and there I help discussing day by day, elbow by elbow, with engineers of different extraction on where we need to improve technology to address real unmet clinical needs. So what I call the clinical issues that are social issues in the vast majority of cases. Although this might seem not realistic, I am much less ambitious than I appear. My main ambition is to transmit what I received. And what I received was an education towards a good scientific mentality, so being able to have a good clinical practice, but at the same time to realize which are the unmet clinical needs and try to find solutions, not necessarily involving new engineering technologies, sometimes just simply changing techniques. I would be very happy without any career achievement if I would be able to transmit this to all the young fellows that I have the pleasure to work with every day.